Good afternoon, everybody. This is Dr. Rao. Welcome. I've been busy all morning with something or other, somebody calling or other. So I'm also preparing for the next Saturday because Saturday is the one that I did a workshop last time on the December 17th, not 7th, I think, December 7th. And now I'm going to do another one on the 14th. Again on Zoom, 10 a.m. to 3 p.m. Okay. Uh, so I just want to talk a little bit about why I started this. What is that feeling? Who are the people who can really um, helped by this? If you have problems of stress, overall stress, or you don't have a clarity about your what is your current health and wellness status, and if you have difficulty about relationships or struggling to find purpose and direction in your life, or inconsistent or ineffective wellness habits, and also feeling disconnected or isolated, or not able to manage your emotions, or lacking inner peace and mental calmness, and difficulty tracking progress or staying motivated. So it's more like a assessing mental, physical, psychological, emotional, and spiritual way you are right now, and what could be improved, or what could be achieved, what could be optimal, right? So that kind of thing really helps people to put it all together and then go from there. Okay, this is my more like a uh, uh, New Year resolutions people make, but in here you are making resolution not just for losing weight or body or something, but much deeper. I hope to help. Okay, so that's what is going on for the next few weeks. One invitation, and then you'll get the recurring, um, the same invitation. But and then the way we want to do is, and we was successful last Saturday was, I met with people in the morning session, 10 to 12 Central Time, and 11 to 1 probably Eastern Time. And then I was able to really present to them what is holistic wellness is, and if you are on the way of any of the realms, like physical, mental, emotional, spiritual, like that, and also what are the real concerns for them as it applies to them. And then we took those concerns, and then after lunch, I met them and worked out practical, physical to attitude to mental to uh, all the way, right? So it's a kind of really finding out what you really need, and then providing solutions right there and then. You may not have the result right away because you have to practice for a while, but the technique and how it is to, for example, um, all the participants really wanted more insight into how to keep themselves more mobile. They want to mobility, how it can be enhanced and all. So I always talk about keeping mobile, and that's not stationary, not for long anyway. You can stay for a meeting or for after, but then get up between the meetings, so and then walk around and all. But I also showed them what is the yogic jogging, yogic aerobics, and also how to find opportunities during the work, whatever we work. How can we be aware of the body intelligence and be aware of the tensions and strains that are building up now, and how to really do the stretching and breathing, minimal, and then also to get rid of the tension. For example, You have tension in the neck, up and down movements like this, to the side movement and like this, but to the front and back, or circumflexion, the whole head going around. That you can do very deliberately, very relaxedly, breathing deep into the stretch. And that would help you to relieve neck pain as it accumulates. And then you can really help yourself to have the range of motion possible at the neck, right? A lot of people leave that alone, and then they kind of form real knots and real tightness in the neck. And then as you advance in age, it becomes tougher, Especially if you want to do the stretches in the morning, that's very tough. But if you do the stretches in the evening, it's much easier. You can start with doing in the evening and come down to do it in the morning, right? So that's what I was trying to tell them, and also showing them how to do that, right? So that's one thing you should really think about. How can I have body intelligence sensitive to it and then go from there? So I was just talking people about what is an IQ, what's an EQ, what's an SQ. IQ, everybody knows, intelligent quotient, math and language problems and all that prowess, and then EQ, uh, emotional intelligence, more like how you can deal with your other people and other people's feelings, and also the world as a whole. And then you have the SQ, where it kind of helps you to really investigate and ask questions, the deeper issues of life. So how much aptitude do you have on that, But there is a BQ, body Q, that is a body intelligence that you want to cultivate so that you will know where the things are brooding, okay, where things are wrong. Okay, suppose you can't see, you can't hear, obviously you go to the right doctor, right? But if you can figure out where your body is accumulating tension and lazy energy, which you call tamas, you don't want to allow that to go on, right? So suppose you are eating very heavy food for lunch, and then you feel sleepy post lunch, and then you are in an important meeting, but you are sleeping. So that is being aware of what my body responds if I eat heavy food, and also cut it down and maybe replace it something lighter that will not induce that. Okay, so having the BQ, IQ, EQ, and SQ, they are important, right? Um, but many people don't may not have the time or the kind of that kind of interest, to really know about themselves in a deeper way. That's what I was going to hope to achieve by giving them an assessment of different layers of human personality, and then really help them to get on a plan, get on something that they would do, or some of the things that they are doing may not be repeated. Okay, so for example, if you are sitting down in the comfy chairs and all that all the time, all through the day, that's a no-no. That is the sitting we're telling people that's like a new smoking. Don't we do that, right? And then you can get up and walk. You can use so many opportunities to make yourself functionally fit during the day. I really enjoy that. When I talk to my doctor friends or nurses or whoever is really not exercising, or don't have the time to exercise, or don't have the means to go to a gym, and they don't have time and all that, right? Then I kind of walk with them to about their work routine, and then I show them several ways to improve the functional fitness. For example, they have 4 or 5 steps, and then they're going up to reach their desk, right? And I will tell them, okay, come up and do the um, up and the reverse direction down. Don't change your, just to get down, and be very deliberate about getting down in the reverse direction. That really improves your balance, improves your leg muscles too. So you can discover any number of opportunities to be doing functional fitness routines that are simple but that are not out of your work routine. And at the same time, you are avoiding this lazy energy or tensions or strains that are building up in your body. You're also saving time and money too, because you don't have to pay for a gym or something, and you can really be. So it's kind of being in touch with your body and where everything goes. Okay, that kind of thing. So I plan to do that kind of assessment, not only how your body is behaving or how you are reacting to it, but also what are you doing with emotions, and what are you doing with your inspirations about doing some things. All these things are assessed in the workshop according to how you want to go from where to where. Okay, so as you follow me through the series of workshops I'm doing, you could really have an assessment of your body, mind, emotion, body, and also the spiritual area, and then you advance as fast as slow as you want according to the program. Okay, so I have actually a program now. It lasts for people who are really interested, really committed. They take a 10-week program. That's a different one completely. That is really focused on one person, completely on his requirements now. But this is like a workshop where people come and discuss these wellness measures. And for example, many people don't drink water. They drink some, bottled sugar thing, right? They want soda. And it is a battle to get them off the soda to drinking plain water. I drink plain water, so I don't drink soda during the day at all. If at all I drink soda, maybe when I have my pizza for the kids and all, then we bring the pizza, and that's when I like a couple of sips. But I don't even drink the whole bottle. So that kind of drinking only water is a very healthy thing, actually. And you should drink enough water through the day, and then through the night, if it's difficult going to the bathroom, then increase the water intake during the day. That will be okay, right? So uh, that kind of assessment of what are your eating habits, what are your drinking habits of water and all that, what are your sleeping habits, and what are your mind management and all that. Of course, I go into the spiritual stuff too, according to the people's interest and all that, right? So that's assessment in the first 2 hours of the not really assessment, asking the questions about what is that they want to understand and implement right now, and then those are taken, and in the afternoon session they are addressed. Last time I think they were asking me about the mobility of the body and energy in the body, and tone of the muscles in the body, and also spiritual inquiry. Because there are a lot of things we talked about, but this is very practical in our face right now. And what is that we could do? Small changes, but they are permanent changes. Okay. Uh, So that's how this workshop is done. But I also have some things ready this time. What kind of questions you may consider? That may be some help just to point out what. Yeah, I don't want to choose a question for you, but I want to indicate the areas of question in holistic wellness. Okay, so then we will go through that, and also we will give them a call to action form where they can fill it out, what is that they want to do in the future, what is that they want me to talk about. So that kind of structure probably helps some people. Okay, so what do you think? Is this worth your effort, or is this something that you want to come and participate? Be my guest, so, and then talk to me about it. As I began to unfold the conference, so many things came out because people were freely participating, and then they told me about their lack of habits or habits, and how to get rid of some of the habits, and also how to gain new habits and participate. Uh, we can go pretty deep though on that. It's up to the people what they want to do. And if they don't want to reveal something very deep, that's understandable, but they can send me a DM, and then I can address it as a general topic rather than one particular individual, right? That way, that person's privacy is protected, but education material and information about that is provided in a general sense. So that also worked out well too. People do really want to find out some spiritual, deeper stuff, then we can go into that. See, it's like a more like a not a lecture like this, or more like a interactive session. I really loved it, and so I thought, why don't I do it every Saturday? Then I announced that, So till January 5th, the same invitation will work for people who signed up, and I'm very happy to discuss all that I know. Like some of the things I'm talking about, how would you really come through your New Year resolutions? Many people make them, but many of my patients I saw they were not able to achieve them. So then I began this kind of proactive thing of doing some lectures to my patients about how to keep them up, how to understand the conditioning of the mind and the body, and how to recondition, how to really go about newer things rather joyfully, but most of the people go through them rather suffering the consequences of breaking the habits that are used to and all. Somebody eating early in the morning coffee and donuts, he will have tough time eating something healthy, right? And so you have to help them to get rid of that. There is science. There is a process. The process is to understand how we condition our body and the mind. Everybody knows that, but they are not willing to part from that conditioning because they may not have enough information, or they may not have opportunity, or they may not have time to do that. So you got to prepare them in so many ways. That way, they can be successful of whatever resolutions they make. In the they see something, and then in the moment heat they form a decision. Oh, I'm going to do this, I'm going to lose 30 pounds in 6 months or something like that. They think, oh, 5 pounds is nothing, but then they gain and then they lose, they gain and they lose. That yo-yo syndrome is a tremendous suffering for them, so you got to understand all that, right? So I am here just to talk to you. If you have any questions or anything that you want me to answer regarding the workshop I'm doing, rather very enthusiastically, and then trying to help if I could, with whatever difficult problems that they have in terms of wellness measures, in terms of people gaining weight or losing weight, and people not able to understand what is organic food and how to cultivate that, and people don't understand what is the way to eat. Eating outside, eating home, that you got to examine it closely and make decisions and have the discipline to stay like that. Okay, so all that we'll discuss too. So whatever topic I take, I don't discuss only what is recommended scientifically, which is okay, but I also want to go into what are the reasons why we want to make change. What is it that we want to change? That kind of thing also. It takes some time. Unless people are working for a long time on themselves, they may not come out of the habits that they have cultivated. First of all, holistic wellness means they think it's all preventive. No, it's not just preventive. Preventive definitely is there, but going about in a proactive way of really knowing what's wrong with our body and mind and all that in a holistic way, okay, all of them, put it all together. It I can bring an integrated yoga where you have yoga for your body, yoga for your actions, yoga for your emotions, yoga for your knowledge, and yoga for your life. Okay, so many things are there, if you integrate according to what somebody is going through. Suppose I see a patient, a very obese person, coming to the clinic, then I would address it so many ways. I have to make them feel like it's not a bad thing to have overweight, but it is something that you would want to continue. Should not affect your self-image and all. That's a big problem with a lot of people, aggravated by people calling them fat, so fatty, whatever, right? So that particular angle is also, apart from not eating too much and exercising and keeping a positive mindset and all that important, but also you have to understand the deep hurt that they go through. When people are calling them, you're fat, you cannot move and all that. So they really feel very bad about themselves. So identifying with your inner essence really helps you to separate the body as an object, mind as an object, and able to work on that instead of being dictated by the reactions, by the conclusions. You will be acting on the body as the body is your object, right? So, holistic health is integrating all personalities, all types of layers that we have in our human personality. There is a food layer, that is the physical body. There is the energy layer, that is our breathing has got everything to it, and then there is the thoughts and feelings and all that. That's another layer, and there is a layer of happiness and bliss and all that. Okay, so once you even know that there are so many layers, it's not like a wrapping around them, but they're together just for the descriptive process which way that. But actually, we have all of them. So if you treat a patient just the symptoms and get him better there, and what he thinks about the disease is miss, or how his body is reacting because he's thinking about his disease all the time. Does that make sense? So many people are involved in uh, mostly in their mind, in their head, right? But I invite people to be in the present, be in charge of what's going on in the head, and treat all the thoughts and your experiences as objects and act on them intentionally, and that becomes the really proactive wellness. Okay, you are having the knowledge about certain things, and then you know what are the lifestyles you want to follow. And if you cannot do that, that's a major area I talk about. Okay, and also if you don't know how to be in the present moment, lots of times people are not. They may be for a while, but afterwards they are not in the present moment. The people who are in the present moment, they know they're enjoying, they're not having the burden of the past or burden of the future, but here and now they are really involved in the life, right? So that's what I want to promote in the holistic wellness, understanding that we are together, the body, mind, emotions, and the inner spirit, right? And then once you understand it, you want to establish yourself in that sense of spirit, right? And then manage your body and mind. You will be much more successful that way. Okay. So this is a, I think it's a good initiative I started because people can evaluate themselves with the assessment that I provide, and then they can look for the recommendations to help themselves. And then that too they will do themselves, the homework and all that. But I show them the way to think, the way to feel, and the way to really be embedded in our real true self. And that's very difficult. You cannot demand people to do that right away. But the more they understand by first listening to the truths, to the facts, and then reflecting on them and coming with insights about what how to go about it and making sure those insights are implemented, allowed to happen in our life. If that is not there, it is just intellectual, it comes and goes, and you'll be thinking. And then sometimes people come very down because they made a decision to lose weight around the New Year time, right? And then they come and tell me they may want some medications to lose weight or all that. But then a couple of months later, they come very depressed because they failed the New Year resolution and they did not lose the weight that they wanted to. That kind of negativity is there too. But then we can help them to see that and transcend that. Okay? Um, so be aware that I'm doing this, workshop every Saturday for the next maybe 7 Saturdays probably. And then there are courses you can take. There are things that you can understand, and my wellness club that's going on in the morning and the evening, and my new membership for the nurturing elderly wise people is for people who have retired but they don't have much meaningful thing to do, and then we can take them to a lot of good areas where they can help themselves with literature, with music, with all that. But then provided by me, and also they may come and explore some things if they want to. Okay. So, and also I continue to coach the doctors and nurses for their burnout, and I continue to coach the IT folks for their stress. And also, I'm really this is something else I'm really improving is corporate health. Now that I understand the ergonomics of things and also general layout of the corporation and how they build so much stress, not only in their employees, executives, but also the customers that they are serving. Okay? They may not be aware of it, but they are doing that. It is basically doing all the time is not going to help you with the stress and burnout. You will be burnout stress. So what I am proposing is do, but also balance it with something you do in the uh, in the interior of yours, right? And then you'll be working better, right? So a lot of people are stressed out and burned out, and they cannot really enjoy their health, even if it is there. So combining whatever we're doing with efficiency, that's one thing I do, enhance the efficiency of the human being, but also enhance the peace and happiness within. That is attending to the being, also balancing it with the being. If you don't do that, then you're going to accumulate a lot of stress and burnout. Okay, don't go only one way. Balance it. First, work on yourself, develop that inner resilience. That's what this workshop is about. And then go out and serve people and do whatever you do in service spirit. Okay. So that's about it. I'm going to open these Saturday workshops and I invite you all. And if you come and support me and ask me questions wherever I can help, I will help. And then hopefully things will work out for you after that. Look up for that advertisement, sign up if you want, and then when you come in the morning, we can have a informal talk first, and whereby we gather what are they doing with their life, what are they doing for their bodies and minds and all that, and how can we help them. That's the thing. Okay. Once you resolve all these external things, you will end up in your joyful being, and then you will be joyful whether you achieve something outside or not. Okay. Thank you, and I will see you later. Okay. So, thank you.